Hi, thanks for tuning back in. This is Ileana Torres, your licensed mental health counselor. Today, I wanted to talk a little bit about attachment and attachment theory. What is it? How does it affect us? And why is it so important? All this and more coming up, so stay tuned. So, I wanted to start out by defining what attachment theory is and what attachment is. Attachment theory was born out of the work from John Bowlby and Mary Ainsworth. It is the study of how your relationship with your parents, and if not your parents, your primary caregiver, how that relationship starting in infancy lays the foundation for the future relationships in your life. So simply said, how your parents treated you affects the adult that you grow to become and the attachment style that you grow to adopt. So what's attachment? Attachment is the deep emotional bond that actually makes you want to be with another person. It's characterized as a special emotional relationship that involves an exchange of comfort and care and pleasure. It's also the reason why you miss someone when they're gone. Normally it's formed in infancy and it's usually with the mother, but it doesn't always have to be. That's why we also say primary caregiver. But it's based on how they treated you. So, if your parents or your primary caregiver were consistently there for you, soothed you when you were upset, always returned when they left, looked out for your needs, responded quickly and positively when you showed them that you needed something from them, then you probably formed a secure attachment. However, if your parents didn't really tend to your needs, they didn't soothe you when you were upset, they were inconsistent in the responses that they gave you, maybe even neglectful or abusive, or simply just didn't show an interest in you, then you may have formed an insecure attachment. Okay, so there are 4 different styles of attachments, and if you see me looking down, it's because I have my notes because I've done my research for you. So, the first type of attachment is called a secure attachment, and this is the result of stable and effective parenting. The parent or the primary caregiver is sensitive to the needs of the child, and they respond positively and appropriately when the child has shown that I need you or I need something from you. They're consistent in meeting the needs of the child. Therefore, the child starts to form a confidence that whenever they need something from their parent or their primary caregiver, they will be there for them. So this results in a very solid parent-child relationship. Where the child, they want to be with their parents and they actually see their parents as a safe base from which they can explore the rest of the world around them, but always know that they can come back to mom or dad or primary caregiver because they're safe. They're also easily soothed by their parent, and if they're distressed in any way, they will actually go and seek out their parent or their primary caregiver because they know, I'm upset, you're going to console me, you're going to soothe me, so I'm going to look for you. They avoid strangers, and experience has taught them, since their parent responds positively, responds quickly, and the responses are productive, they learn that I can ask for help and my needs are safe and okay, and they will be met. Now, luckily for us as a society, roughly about 70% of all children end up forming this kind of attachment. And these kids end up growing up to be autonomous and secure and explorative. They're able to manage their emotions in stable ways, and they form positive self-image and positive self-esteem. So let's move on to the next one. The next form of attachment is called insecure avoidant attachment, and it's actually characterized by the child's emotional disengagement. This is because the child doesn't bond with their primary caregiver because they can't count on them. Experience after experience has taught them that their parent will not be there for them. They've seen their parent be either extremely dismissive or even neglectful of their needs. So they start to think, why bother reaching out when nothing happens anyway? So they're going to avoid their parent. And when they're upset or in distress, they're not going to seek out their parent for comfort. This child shows little to no preference between their own parent and a stranger. And as a side note, this child shows very little fear to strangers. Now, when it comes to their own parent or their own primary caregiver, the child with an insecure avoidant attachment does not see their parent as a safe base from which to explore the world. Their parent may withdraw from helping during difficult tasks or situations, or may even be outright unavailable during times of emotional distress. Therefore, if the parent leaves, the child shows absolutely no interest. And when they return, it's like, more of the same, no interest at all. So this kind of child grows up to be very physically and emotionally independent of their parent, and unfortunately tends to become emotionally distant. Now, luckily, this only affects about 15 to 20% of the child population, but that's still a lot. And this child learns from an early age that emotions don't work, and I can't rely on anyone, so I'm not going to bother. The next form of attachment is called insecure ambivalent or resistant attachment. And this is actually characterized by the child's emotional anxiety in terms of their anger. This child adopts an ambivalent behavior style toward their parents because they've learned to realize, I can't rely on you for my needs to be met, because the parent or the primary caregiver is inconsistent in their responses. On the one hand, they're very receptive in responses to the child's needs, sometimes being very sensitive, and other times they're outright neglectful. It's like black and white thinking. There's nothing in between. This child ends up becoming very suspicious of strangers, and when they're around their own parent, they're very clingy and show dependent types of behavior. When the parent or the primary caregiver leaves, they show severe distress. But when they come back, they're not reassured or comforted by the return of their parent or their primary caregiver. So this child actually fails to develop any feelings of security from their parent or their primary caregiver. Yet, they still exhibit difficulty from moving away from their parent or their primary caregiver to explore the world around them. These are really confused children. This is also associated sometimes with child abuse. There's about 10 to 15% of the children population that actually end up with this style of attachment, and this child will end up growing up to be anxious, possibly insecure, or even an angry adult. The final style of attachment is called disorganized attachment, and this is actually characterized by no particular attachment strategy on the behalf of the child. That's because they're severely confused on how to get their needs met, because their parents' responses have been either passive or intrusive, frightening, erratic, or even extreme. The parent of this child causes them to feel both reassurance and fear, which leads to disorganized attachment because the child can be both comforted by their parent, but is also very frightened by their parent at the same time. So the result is confusion. The child will show a mixture of avoidant and resistant behavior. They may seem dazed, confused, apprehensive. What's really sad is that some of these kids even take on the caregiver role of their parents so that they can quell the negative emotions from their parents and they don't have to deal with the extreme erratic nature of their behavior. And this can happen as young as 6 years old. When this child's parents leave for any reason, this child is relieved. They want to not be with their parents, even if it's for a short period of time. And when their parent returns, they can't be comforted, soothed, or consoled by their parent because that response that the child gives is either negative emotions or frightened. And since they can't be soothed by their parent, this type of child is much more easily soothed and consoled by that of a stranger. Now, there's about 10 to 15% of the child's population that forms this kind of attachment. And this child will grow up to be depressed, passive, angry, or non-responsive, simply because that's what they've been taught. When they presented needs to their parents, to their primary caregivers were either angry, passive, non-responsive. This child has learned emotions and attention don't work. So, why are these attachment styles important? Attachment impacts a lot. It actually impacts how we view ourselves in the world around us. It affects our self-esteem and our self-image. It affects how we approach problems and how we cope with challenges, trauma, and the stress of everyday life. It affects how we establish and maintain both friendships and romantic relationships. And it affects how we deal with our strong emotions. Sorry about the jackhammer. Construction in downtown Orlando. The long-term effects of secure attachment are the child will develop a sense of basic trust. They'll have a positive self-image and a high sense of self-esteem. They'll actually become autonomous. They'll have good problem-solving skills. They'll be goal-oriented and determined. This child who forms a secure attachment has the long-term effect of realizing, I can do this, I have this ability, and it actually makes me feel good. The person who forms a secure attachment in the long term will be able to form strong relationships because they'll have the strength and ability to form a strong social network around them. They'll be able to build positive and stable bonds with others. They also have really good coping skills and strategies. They have a combination of hope, a positive outlook on life, good self-esteem, and an availability to reach out when they need help, with the expectation that help will be there when they do. And they also have good emotional control and flexibility. The person who ends up with a secure attachment actually has more ego resiliency, which means that they're good at adapting to new situations and controlling their impulses and their emotions. Now, if it's an insecure attachment that was formed, it doesn't mean that this is how it's going to be for the rest of your life, because there's a whole nature versus nurture debate, which I'll get into in another video. But for an insecure attachment, the long-term effects of that, the child doesn't see their parent as a safe base from which to explore the world. So they're going to be limited in their exploration. And with limited exploration comes limited skill development. With limited skill development comes a limited feeling of mastery of anything. This child believes that emotions don't work, so I can't rely on anyone. So you'll see them in the long term become emotionally detached. They may develop an emotional awkwardness or have a tendency to hide their feelings and not express negative emotions. They also have a lack of trust. They don't trust that if they reach out for help, help will be there, because time and time again, they've reached out for help and their primary caregiver has failed them. They also have a lot of relationship challenges because of their either distant nature or their restricted emotional availability. It's difficult to build and maintain relationships. They question, what if I get rejected? It's better not to go at this in the first place. So they may keep themselves busy to avoid interactions. But on the flip side of that, with an insecure attachment, you can also develop an obsessive nature or an extremely jealous nature as well. If you form an insecure attachment, a long-term effect will also be having difficulty controlling your behaviors and your emotions. And this comes with a confused sense of self-image, and that's because your primary caregiver was inconsistent in the responses that they gave you. If you formed an insecure attachment, it doesn't mean that you're doomed for a less than life. It just means that you have more work to do than the average person. So I would suggest building up your social network, finding at least one trusted person that you can go to. Get yourself into therapy. There are a lot of things that you can do, even if you form an insecure attachment, that can still help you to become that autonomous, explorative, and well-adjusted person in the world. So I just wanted to take a moment to thank you again for tuning back in. It's only video number 2, so we're just getting started. So remember, in the comment section below, please let me know what kind of content you want. Give me some ideas to make some more videos for you. And I was wrong in the last video. It's actually going to be here, the subscribe button. So make sure you like the video and subscribe, so every time I put one out, you're the first to know. So let's do what we can together as a community and heal from the pain of your past to live your best life possible. Thanks for tuning in, and I'll see you in the next video. Bye.